the healthy diet, fruits and vegetables, whole grains, low-fat animal products, if you choose to eat animal products, can save several 100,000 lives a year. And there's a general agreement on that. Several 100,000 plus or minus 100,000. Let's not worry about details, but tremendous opportunities to have healthier lives and to save huge amounts of money in healthcare costs. So that's the science. There's a good, strong basis for taking action on diet. A tremendous impetus has been provided by the obesity epidemic, particularly in children. Obesity, rates of overweight and obesity have tripled in children over the last 30 years, since around 1980. Before then, for the previous 20 years or so, rates of overweight and obesity were pretty flat. So whatever happened that's when things began. And that has really shocked the public health community, many parents, many health professionals, into saying, we got to do something about this childhood obesity problem. And for a number of years, people have basically said that and then wrung their hands saying, what should we do, as if they didn't know the solutions. But the solutions cost money and might step on corporate toes, and that's what prevented action. A third thing that's happened since, in my mind, it was since March 1970. I went to the first Earth Day celebration at the University of Michigan, and I stayed in a group house, and we made brown rice and vegetables. It's the first time I ever had brown rice and vegetables. First time I ever chopped vegetables and sauteed them. And that was kind of my introduction into hippie culture. And I've been eating like that, not quite like that ever since. But that kind of meal bespoke of the grassroots activism where people were learning on their own, no help from the government or the medical community, learning on their own the kind of diet that is healthy to eat, how we were encouraged to eat unhealthy diets, some of the big companies behind it, sometimes revolving door between government and industry, where you'd look at the officials at the Department of Agriculture or Food and Drug Administration, and they were all graduates of General Foods and Coca-Cola and the National Dairy Council. And but then, people started food co-ops, maybe started gardening. Some people went off to their communes, and that was kind of the little egg from which a lot has sprung, and sometimes that moved up into the city and state level in terms of government interest and support, and now the government in the last few years, governments. Especially city and state governments, but now in the past year the federal government, have gotten very involved, and sometimes for selfish reasons, healthcare costs going through the roof. Maybe we should have healthier people and talk about health, not health care. So there's been movement there, and in the last year, the Obama administration has been a tremendous force, with Michelle providing kind of the gentle touch where she can talk to average people about the value of growing your own food, having a vegetable garden, eating healthy, and she's always quick to emphasize you don't have to be a purist about it. 1 teaspoon of sugar is not going to undo the rest of a healthy diet. And so with the Obama administration and a Congress that's friendly to health, a Congress that sees I'm going to step on some Republican toes here, I'm afraid. Ronald Reagan famously said, government is not the solution, government is the problem. Well, in some cases that may be true, but in public health, it ain't. And now we're seeing a blossoming of activism, sometimes bipartisan, sometimes not, and sometimes industry gets involved in a supportive way. That's such a remarkable change And it's not necessarily a change of heart in the stockholder meetings, but a recognition that we're in a different era and that cooperation may get them more than opposition. And what a lot of companies would like is to do things voluntarily without government regulation. And if they can do enough, then great. But so we're seeing, the grassroots activism, the political establishment in Washington, a lot of city and state governments, especially, I want to give special credit to the New York City Health Department under Mayor Bloomberg, who, there's a Bloomberg School of Public Health at Johns Hopkins University. Bloomberg is a public health expert who has breathed new life into that health department that has become the most activist health department in the country, and that is leading to changes. New York actions have led to changes elsewhere and into the federal government. And so the confluence of those four factors, the advance of science, the obesity epidemic, the civic involvement on the part of organizations and individuals, and then government involvement, I think put us at the cusp of enormous progress. And we're beginning to see some of it that should lead to major improvements in health. Whether we will all end up svelte in 8 years, I can't promise that. But at least maybe we'll be on the road to that. And even if we're not so svelte, maybe our blood pressure will be a little lower, our arteries a little healthier, our teeth a little shinier, and it'll be a great advance for everybody. So I wanted to talk about some of the specific examples that have been going on that exemplify some of these changes. One of them has to do with restaurant foods. Restaurants provide about a third of all the calories we consume. But when you go into a restaurant and look for information about what it is you're eating, you're not going to find anything about the nutritional quality or the ingredients. If you have an allergy, you have to ask, and maybe somebody there will know. But and some of the meals you get at restaurants are the heart attacks on a plate kind of food. Meals with 6,000 milligrams of sodium. That's 4 times as much sodium as most of us, except for those guys over there at the end table who are still in high school, 4 times as much as we should be consuming in an entire day from one humongous meal at a restaurant like Red Lobster. Some of the restaurants have put the little hearts next to their menus, saying they're healthy in some way, and they are healthy in some ways. Typically, they're loaded with salt. Everything is loaded with salt. You can get some low-fat, some high-fat meals, but they're all loaded with salt, and consumers have no way of knowing how many calories in the Big Mac. Well, cities and states, and it started with New York City, they passed a law requiring calorie disclosure on menus and menu boards at all restaurants that are parts of chains 20 or more. So that sweeps in the McDonald's, the Olive Garden, table service, and regular ones. And that made it safe for other cities and states to do it. The restaurant industry fought it every inch of the way. They sued New York City twice. But California passed a law, Massachusetts, Nassau County, Westchester County in New York, Philadelphia passed the toughest law, Seattle. So there's this proliferation of laws, and they were a little different. Philadelphia's is very different from New York City's. California doesn't require calories on drive-thrus, but it does in New York City and Philadelphia. Seattle, you can put the calories on the menu, or you can have a separate menu. Philadelphia says not just calories on the menus, but saturated fat, trans fat, sodium, and carbohydrate.